You know me, I don't talk about certain things unless needed. Now, as you can tell by my community tab, you know exactly what I'm going to talk about, right? Now, the reason why I'm going to talk about it because I thought I'd look into how this will affect the children's life when they get older, um, as they get older. Now, I was brought up by a strict parent. I'm sure many of you was brought up by strict parents where they'll just look at you and you just move and whatever. Um, but but there's parents that discipline their children in different ways. Now, my unks with all this angst, with all this thing is now now you choose a time to shout at your children when the live is on, when you're doing something. It's like you don't want the children there. So I decided to go and look into what effect this will have on the children later on, either in life, in their transgressions, and how they will need possibly help when they're older. Right now, I might not be able to do all of it today, but I'm going to do some of it. Okay. Now, I went to find out. Oh, yeah. So, this is what I found out. This is what I found out about how children is abused and traumatized at home, how it will affect them in adulthood. Now, children who experience abuse at home often carry the trauma into adulthood, manifesting in various ways. Difficulty with relationships, struggles with self esteem, emotional dysfunction, anxiety, depression, substance abuse, difficulty managing stress, often stemming from a distorted sense of self worth, learned coping mechanism developed during their childhood, developed during childhood. So just say that how now I know being with strict parents, when you are shouted out like that, especially if it's on a regular basis, you're not being fed properly, your needs are not met, it has a great effect. So, for example, right, a child will lose their self worth from young, thinking that they're not worth nothing. We now I can use numbers of movies that have these stuff, and even in real life, there's people who use self worth, has fear of a lot of things. They carry on cycles. Their life doesn't evolve. They soon later have to go and get um, therapy in the process. Now they call this something like PTSD abuse in adults. Now, the key ways abuse traumatized children might manifest their traumas in adulthood: relationship difficulties, difficult trusting others, fearing of intimacy, difficulty communicating emotions healthy, attracting abusive partners, isolating themselves from others, emotional disregard, disregards, disregardation, extreme mood swings, difficulty managing anger, feeling overwhelmed, easily difficulty calming down, depression, anxiety, PTSD, disassociation, eating disorders, which possibly can happen to those children who we know who is spoken about on a regular basis, and their mum. Feeling worthless, not good enough, self blame, difficulty accepting compliments, substance abuse, self harm, uh, withdrawal isolation. Important factors to consider: the types of abuse, the specific type of abuse, physical, emotional, sexual neglect can influence how the trauma manifests in adulthood. Support system: having a strong support system can help individuals heal from childhood trauma. Now let's go to the PTSD side of it. to see how deep this thing is affecting them children in that house.
This is what PTSD from childhood abuse in adults looks like. Written by Ashley Lederer. Clinically, childhood abuse doesn't just affect children at the time of the abuse, it can cause long-lasting impacts into adulthood, including post-traumatic stress disorder. Read on to learn more. Trauma. While we would hope that all children experience no harm while they grow up, the reality is that not everyone gets a picture-perfect childhood. Sadly, the Centers for Disease Control and Prevention, CDC, estimates that 1 in 7 children has been abused or neglected in the last year. And the actual number is likely higher since many cases of abuse or neglect go unreported. The impact of childhood trauma isn't just a matter of the past. Experiencing childhood abuse can result in long-lasting psychological scars that persist well into adulthood, sometimes resulting in post-traumatic stress disorder, PTSD. Here's what you need to know about PTSD in adults due to childhood abuse, including symptoms and treatment. PTSD from childhood abuse in adults. The development of PTSD in adulthood from childhood abuse is rooted in the significant impact that trauma has on a child's brain and overall well-being. Childhood abuse disrupts a child's sense of safety and trust, leading to long-lasting trauma. Imagine childhood as the foundation of a house. If there are cracks in this foundation due to abuse, the entire structure can become unstable, says Alyssa Scolari, a licensed professional counselor specializing in trauma. These cracks might develop into PTSD as one grows into adulthood. Healing from trauma is possible. Get started with Charlie Health's Trauma Informed, virtual mental health care today. Get started. 1-866-484-8. Not to mention, trauma results in changes to the brain. Researchers have found that these changes may be even more significant when childhood trauma occurs in a young person while the brain is still developing. These changes can disrupt the normal physiological stress response and affect how chemical messengers in the brain function. Childhood trauma can also impact brain regions such as the prefrontal cortex, involved in mood and emotional regulation, the hippocampus, associated with learning, and the amygdala, related to the fear response. These brain changes may be associated with symptoms of PTSD or even additional mental health conditions. Types of child abuse that can cause trauma and ultimately lead to PTSD in adulthood include 1. Physical abuse. 2. Psychological/emotional abuse. 3. Sexual abuse. 4. Neglect. Just because the child abuse happened in the past, it doesn't mean the impact stays in the past. For many survivors, the abuse becomes deep-seated trauma, impacting them into their teen and adult years. Think of it as having an old injury that sometimes flares up, says Scolari. For many who experienced abuse in their younger years, the past isn't just a distant memory but an active part of their day-to-day life, influencing feelings, choices, and interactions.
Right. So because of that small video that I took down, right, I want to also include the part in which food play when the parents traumatizes the children when it comes to food, like how they were shouted at that precise moment. Abuse traumatized children often use food as a coping mechanism, leading to disorders. Disordered eating behaviors like overeating, binge eating, or over restrictive eating, where they may use food to self-soothe and manage difficult emotions triggered by past abuse, potentially resulting in weight and unhealthy relationships with food. Key points about how abuse traumatized children might use food in adulthood. Turning to the food as a way to comfort themselves when experiencing stress, anxiety, or negative emotions triggered by past abuse, which means that they can have anorexia, anorexia nervosa and other things. Like, for instance, like if food was shared a certain way, like in the West Indian terms, right, we call that counting the grain. Um, right? Like if you are only given a small amount of food or a less amount of food, and you're not allowed to get to the food yourself as a child, right? Where like your child, i.e., at a certain age, they learn to prepare food, they learn to um serve themselves, like, and there is kind of like a marginal size to what a child eats, which means that how they have to be encouraged to eat multiple, like the food pyramid, for instance, they need some of the food pyramid. Yes, you can have fussy eaters, that's different. Fussy eaters is different. If children eat food and they eat any type of food, that's a different sort of thing. If you are restricting food, locking food away, which I know back in the day some parents used to lock food away in cupboards, lock snacks away in cupboards, but it wasn't like there was abusing them. Basically, it's just to make sure that the children don't overeat sweets and overeat certain stuff unless they eat their food. If a parent is taking away the food, because that is a form of abuse, which the child will incur, have an eating disorder, i.e., binge eating, which is what is said here, like restricted eating, severely limiting calorie intake, food types due to distorted body image, fear of gaining weight, which can also be linked to trauma, food addictions, developing an unhealthy relationship with certain foods, often high in sugar or fat, using them as a way to self medicate. Trauma related triggers, specific foods, eating situations may trigger memories of abuse, which is what that lady's doing right now, leading to emotional distress while eating. So they're going to need help later on. When others' aspect of life feel out of control, food can provide a sense of agents agency over one's body. So that means that they are able to control the food. So which means that how, in a matter of fact, with some where they eat the food and then throw it up, right? Because we know people do that. Food can be used as a numbing emotions. Eating can be a way to numb, suppress painful emotions relating to past abuse. Right, physical comfort. The act of eating can provide physical sensation of comfort and security, especially when experiencing emotional distress, which these children are going through right now. Right, so we're going to go to RS, I think it's RSCPC, and there's a lot now.
How common is PTSD from an abusive childhood? Sexual abuse, physical abuse.
Hold on, that's not it. It's a lot, man. That lady is traumatizing them children every single day, every single minute, every year. If she doesn't want the children, she should just let the children go and be with their dad. Right? I don't like the guy. I ain't even gonna big him up like that. But the main fact that how you shouted at them like that, and I want to see now because like,
Clinical. Volume 49.
Because of what's going on in America now, right, with the food situation, the food's gonna change, the stance is changing, everything's changing. How are you gonna deal with that? Because that means that how you got to find another way to do other things. You cannot be taking out your frustrations on what is on the internet on your children by stopping them from getting that substance what they need. I don't even think this is the
Clinical.
right one.
Childhood trauma is common and can have profound consequences throughout a person's life. Adult survivors of childhood abuse pose a number of challenges for general practitioners, GPS. The diagnosis of their medical and psychiatric illnesses is complex, the therapeutic relationship can be both delicate and critical to recovery, and the treatments are varied, often expensive, and frequently inaccessible. Objective. The aim of this article is to provide a conceptual framework for the assessment and management of an adult survivor of childhood adversity. Discussion. GPS can be effective and facilitate recovery-orientated, trauma-focused care, even when local services are limited. This model considers the person's presenting symptoms and the consultation interaction, and it is applicable regardless of diagnosis. Key principles include listening and engaging to understand why the person is presenting in this way, and approaching care in a targeted and collaborative manner. This can alleviate emotional distress for the patient, GP, and care team. Childhood trauma is common and can have profound consequences throughout a person's life. Box 1. Although the total prevalence of childhood mistreatment is difficult to measure, it may be as high as 28%. Trauma is more common in women and in population groups that have a higher incidence of cumulative or intergenerational trauma, such as refugees or Aboriginal and Torres Strait Islander communities. The impact of childhood abuse is significant, comprising approximately 2% of the total disease burden. Cumulative trauma, where there are multiple adverse childhood experiences, leads to poorer health outcomes. Box 1. What is childhood trauma, and how common is it? Adverse childhood experiences, ACEs, is the term used to describe all types of abuse, neglect, and other potentially traumatic experiences that occur to people under the age of 18 years. ACEs have been linked to risky health behaviors, chronic health conditions, low life potential, and early death. As the number of ACEs increases, so does the risk for these outcomes. The presence of ACEs does not mean that a child will experience poor outcomes. The definition of child abuse and neglect can be found on the Centers for
Right. So what's going to happen is they're going to have a bad relationship with food all round. That's PTSD. That means that their mental health levels is going to change everything. Oh, what just happened? So, I don't know, man. That lady, if those children don't get early help, if nobody don't step in and do something, once again, I will say it again, if nobody steps in to help those children, they're going to have a lot of problems with a whole heap of things. Oh, my thing chooses to play up now. So, hold on, let me restart this thing here. Because it's just so crazy how this lady sits and shouts at her children, and it's a ha 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 moment. But you're not the one suffering. You're not at the other end of that every single day. 360 days in a year, I think it is, day in, day out. And I do believe that how Ava do have an eating disorder right at this present moment, because she's very skinny. She should be a little bit taller for her age. But enough, some children have small bodies. Not every child does be big due to amount of food or whatever the case may be. Now, anybody who has grandchildren, children, nieces, nephews, whatever. Hold on, let me see what's going on with this thing. Right, Ava's very small for her age right now, and it's just very crazy because the Pediasure that Straight Facts was talking about, I had the Ensure to that because I'm a very small person myself. I have a fast metabolism, so I always have to take certain stuff so I can put weight on, etc. And Ava needs that because of how small she is. She always looks like very gawked in her face. She's very small. She should not be the same size as her little brother. She should be a little bit bigger. One, because of the type of food they eat. Not when she's cooking the processed food, when she cooks like meats and different things. Now, obviously, when she's at the other house, she must get food, balanced, some sort of balanced diet. Now, not only that, right? Some children like that normally need vitamin C because they are very skinny, very frail, and they need something to give the extra impact. Now, if this is not being advocated and given, the child will show it through. I'm actually quite surprised that the school hasn't picked up on it, because schools picks up on a lot of things. If your child is sleeping a lot in the school or certain stuff, the teachers will tell you, oh, well, like your son, daughter is sleeping too much. That's also down to how they eat in the morning. Right, you also got to give them like you got to give them milk because they need that bit of calcium. You need to give them like protein. You need to give them some kind of fruit. If your child likes have a favorite fruit, a favorite thing, you're supposed to get to them. Now, this lady do not have all that. She doesn't want to buy that. She don't want to feed them what is given to them. And let me see, because the one child is very underweight. He looks very underweight. So let me see if I can. Right. So child mistreatment and disordered eating in adulthood. So the current study investigated relationships between different experiences of child maltreatment and disordered eating in a large population sample of Danish young adults. The participants completed a structured interview of psycho of what because of the places where they are, etc. Let me see if it's got more. Does it really get to the point? Okay. Because they're bringing out all kinds of different abuses. They're not looking at the other stuff what I'm looking at. Right. They're gonna have not a good relationship with food. Ava's not gonna have a very good relationship with food. It wouldn't surprise me if one of them is eating and chucking up somewhere. That's another sign of abuse, disassociation with food, etc.
The link between childhood trauma and eating disorders. Millions of people throughout the United States suffer from eating disorders such as anorexia nervosa, binge eating disorder, BED, and bulimia nervosa. Though it affects both men and women, women are more likely to experience anorexia nervosa, 75%, and binge eating disorders, 60%. Several factors can contribute to the onset of an eating disorder, such as genetics and family history. However, one of the most common factors linking eating disorders is a history of childhood trauma. Children who experience emotional, physical, or sexual abuse are more likely to develop psychological issues, including body image and eating disorders. The role of childhood trauma in eating disorders. The link between sexual abuse and eating disorders is well documented and readily accepted by practitioners. Of particular note, however, is the evolving understanding of other trauma, such as physical and emotional abuse, and the role they can play in the development of an eating disorder. Emotional abuse, for example, can lead to low self-esteem, self-critique, and issues with body image. Eating disorders become a mechanism for maintaining control when a person feels like they numb and serve as a way to avoid the emotional trauma head-on. Trauma can be so severe that it actually disrupts the functioning of the nervous system, to the extent that it is difficult or impossible to regulate their own emotions. Negative behaviors such as binge eating or anorexia become coping mechanisms that keep trauma victims from processing difficult emotions. Much like post-traumatic stress disorder, PTSD, dysregulation of the body's psychobiological systems results from the exposure to childhood trauma. Emotional abuse and eating disorders. Emotional abuse takes the form of continual criticism, insults, or attacks against a child's character. Over time, these children internalize the criticism, perhaps even believing it to be true. This emotional abuse and its internalization makes children susceptible to eating disorders and dysfunctional behavior. Children who are emotionally abused are just as likely to develop eating disorders as those who experience physical or sexual abuse. A recent study explored the clinical linkages between eating disorders and emotional abuse, noting that emotional invalidation is a core component of the development of eating psychopathology. Emotional abuse poses large risk factors for later eating disorders by creating poor tolerance to distress, stymied emotional development, and problems with emotional inhibition. People who bear the brunt of repeated insults or excessive criticism, over time, develop similarly critical view of themselves, which leads to problems with body image that can manifest as anorexia, bulimia, or BED. Sexual abuse and eating disorders. The link between sexual abuse and the psychopathology of eating disorders has been extensively studied, but it is still subject to some debate. A recent review of the literature found that around 30% of eating disordered individuals sampled had experienced childhood sexual trauma or sexual abuse. There are complex associations between the type of trauma, inherent issues in self-regulation, and other risk factors that may make it difficult to pinpoint the exact effects sexual abuse has on the later risk of an eating disorder. Research does indicate, however, that people who experience sexual abuse are slightly more likely to develop bulimia nervosa than anorexia, BED, or other forms of disordered eating. Some experts theorize that sexual abuse can cause a person to develop an eating disorder because they believe they need to look a certain way to be considered attractive. In this manner, a person can seemingly be in control of their lives, but also find an outlet for the emotional pain and turmoil of the sexual trauma. In the case of bulimia, there is an inherent symbolism in the etiology of the disorder. For example, bulimic behavior helps a person purge the negative feelings associated with the trauma while the food helps fill an emotional void. They both become coping mechanisms that help a person avoid the trauma of their experience. However, it does not provide the answer that the individual needs to heal. Stress eating as disordered behavior. Though not the same as traditional eating disorders, there has been interesting studies of stress eating and how it can develop in childhood as the result of trauma. For example, a study at the University College London of identical twins found that disordered eating patterns can begin as early as 2 years old, not because of genetics but due to environmental factors. Even in cases where the parents were obese, emotional eating was driven by environment, not genes. In the study, when confronting stress, some children went for a favorite.
Okay, so I'm going to have an example of this. I'm going to put up this as an example, okay? Because if I don't do it, I will not be true to myself, okay? Now this, hold on, let me see.
Get out of my pantry!
Hold on. What I want to show is the children, how they behaved when spoken to like that. Let me see. Is it going to play?
Going out, girl! They is irritating me today.
Hold on.
They fucking cry too much. This shit irritates me. Go to your room, close my door.
Right. Let me see if I can catch it.
Get out of my pantry!
You didn't see the girl jump, she jumped. So they're going to have a problem. They're going to have a problem with food. These children are going to have a problem with food later on in life. That's basically what I'm trying to highlight here. Whether you understand it or not, whether you get it or not, whether by making it clear or not. This is what's going to happen to them later on, because they are going to have a problem. They're always going to think of their mum shouting at them when they have to go to get food, etc. I don't even know whether you saw it. I don't know, but I'm going to continue the thing. They continue to explain how deep it's going to go for them, right?
Snack, while others lost their appetite. The parents of the children recognized these behaviors as responses to being upset or anxious.
Hi.
The
Hi,
researchers
Medusa.
noted that emotional undereating or overeating in childhood could set the stage for possible disordered eating later in life, when stress naturally increases. A similar study at Huntington University found that the higher
Now remember that these children went through this as they were coming up, where they wasn't being fed properly, there's been locked away, they wasn't being given the food. She was eating in front of them all the time. Therefore, this will cause them some kind of anxiety, which is what the article's trying to explain. Right? There was like the eating as an addiction. They're going to use the eating as an addiction.
Modern psychology considers both emotional eating and binge eating as addictive behaviors. Much like illicit drugs.
And that's what the mother's got as well, because she's got an eating problem herself.
Person who emotionally or binge eats gets a high from the experience from increased dopamine levels. Like illicit substances, a person who binge eats will want more or feel like it is never enough. This is called a process addiction. It is marked by a compulsive behavior.
Now, let's hear it again, right? Let's hear it again. Let me see if I can take it back.
Get out of my pantry! Going out wrong!
They're hungry.
Irritated me today.
Hungry. They're hungry.
They
hungry.
fucking cry too much. This shit irritates me. Go.
I have a little one here, and she's very fussy, very fussy, very fussy, that she would only eat particular thingies. Now my other child was like that, where she was very fussy. These children are different. They'll eat crab, they'll eat lobster. I don't eat pork, but they'll eat pork chops, lamb chops, whatever, right? So what I'm trying to say is this is going to impact her later on, impact them later on in life, right? That's the whole thing of this whole life, basically. The whole thing of this whole life, right? The children is going to be impacted by this behavior because they was impacted before with the behavior when they were younger. So in her mind, this is okay, but it's not okay. It's not okay, right? That's what I'm saying. That how, yeah, she's being disgusting, selfish, and evil, deadbeat parent, neglect. Yes, she has, but it's going to impact them later on. It's going to impact them later on. Really impact them. Hold on, I think it's
that eventually becomes a health threat because it leads to obesity and all of its associated health risks. Emotional eating and stress eating may not be officially designated disorders in the DSM-5, but they both have links to binge eating disorder and trauma. Both can evolve from low self-esteem and cycles of shame, guilt, and overeating. When emotional and binge eating disrupt daily functioning and life quality, it can become binge eating disorder, BED. Is there a link between eating disorders and PTSD?
Yes.
Researchers have found an interesting link between post-traumatic stress disorder, PTSD, and eating disorders. For example, women who present with eating disorders also show signs of PTSD or anxiety disorders as pre-existing or comorbid conditions. Often, the presence of trauma creates...
Because this is a form of abuse. In the care training, you are taught about the different abuses and what's the impact it has on a person. It can be very impactful. Very impactful. Even if it's a grown adult, it's very impactful because they would either put it on more, they would binge it, right? You know, fair enough, right? They got the mukbangers coming out and whatever, they're eating loads and stuff, but there is ones like, I forgot her name. There's a lady and she's very skinny and she's got anorexia nervosa. She is how um this can impact. She must have had something in her early life why she's doing what she's doing. Because sometimes when people do things, sometimes it impacts her memories of what they had when they were children. So it continues. It's like they say, so-called cycle. So what she's doing, she's giving them a cycle that is continuous. They're gonna have a problem with food. They're gonna have a problem with other things, which I've done lives on before. They're gonna have problems with trusting people. They're gonna have problems with um certain words will trigger them. Like the child literally jumped out her skin when she shouted at her. I saw it, but I couldn't catch it. I saw it on the screen. Now I did put it up and I took it down. You know why I took it down? Because the what I was looking for, I couldn't find it. I couldn't pinpoint it because that right there is going to impact them. Now, me personally, I feel that the children should not be there, whether it's once a week, twice a week, every other day, because she doesn't want them. She don't want them, right? She wants the benefits of having them there, but she doesn't want them. So therefore, what she's doing now, she was talking about putting a lock on food cupboards. That can also, right, especially if it's food. It's not like you're locking away snacks. Snacks is different. If it's food, if it's food, you are looking away where the children can go and help themselves, right? You're lying down in the bed, right, all day, right? And your children will be able to go cook little food. Like my children started cooking about 12, 10. I think they started cooking for themselves, right? They started seasoning chicken, they started seasoning little things, they started making little things. She's not giving them that love of food. The only time they get love of food is probably when they're with Hannah and Philip, which is not the case. Not only that, right? It will get to such a level because remember, children don't stay little children for long. She feels that she can continuously control their food, but at one point you're not going to be able to control their food. At one point you're not going to have that control. I remember when Flo did a live on this situation long time ago. I think she spoke about her hating the children and other things pertaining to their food and whatever. And this is exactly what's happening. So the fact of the matter is this, right? Do we feed the vampire so she can continue sucking on other things while she hurts those ones in her care? Fair enough. I'm not saying don't react on her, no, but react on the stuff that really impact the children, because it's important that everybody gets an understanding how these things are impacting. Now, I know that Suma said that she's done child developmental studies, and I would love to talk to her on that, because all this is going on for years now. She said that she's been doing YouTube for 11 or 13 years, something like that, right? This is impacting on the children daily, because remember, there's lives, there's vlogs, there's this, and you can tell that the food is not being distributed properly to the children. It seems like it's carried. The food is not fresh, 1. 2, there's no love put into it. There's favoritism. There's a lot going on. Oh, she did say she's looking up the cupboard on food. Yes, she did. I heard that through one of the people then.
Anxiety or PTSD, and the eating disorder emerges as a coping mechanism for those symptoms. In fact, some research suggests that post-traumatic stress disorder can actually be a mediator between experiencing trauma and developing an eating disorder. For example, a national women's study found that a high percentage of women who experienced an eating disorder also had a diagnosis of PTSD. Many survivors of childhood trauma have at least some symptoms of PTSD, suggesting that they have subthreshold manifestations of the disorder. At a basic level, there are many commonalities between post-traumatic
it's not good for their mental health. It's not good for their mental health. Like I said, you can discipline a child. Yes, you can. Yes, you can. I grew up in a strict home. They used to shout, but not a shout like that. Not stop you from eating, not whatever. Obviously, right, come a certain time, right, you clean. You know, it's not as there's a lot of black women, well, so I say, well, mostly black women, certain houses that do certain stuff that is not for the good of the children. Sometimes it's for the detrimental of the child growing up in later years, because then the child have to dig itself out of the PTSD and out of the trauma so that they can become stronger, because it's a matter of them turning like it says illicit drugs, alcohol. They might like later on they might escape in in that thing, which means that how the wolves are ready to take them at any time. As they get older, the wolves are there. If they're not guided, right, right, like it would have been good if the Davis Four had older ones, older than them, because they will impact. They will make sure that they don't go off kill. They'll make sure that they don't be doing certain stuff. They'll make sure that they will be that they can show them certain skills. Because what the mum don't show the children who are like who have people who have adult children, the other children will show the younger children certain stuff and give them little skills. And it's not like they're being the parent, no, because they being children themselves, so they can more tap into the that tiny stringly piece of food that she gave them for breakfast. Yes, it's not good. It's not good at all. It's not good.
Stress disorder and eating disorders. For example, people with either condition tend to be impulsive and may experience dissociation. It is important to note, however, that the method of dissociation may be different. Binging and purging is a method of dissociating from trauma,
Purging.
as is using illicit drugs or alcohol to escape. How eating disorders impact mental health. Eating disorders have obvious negative health effects. From a physical perspective, a person with an eating disorder may be at higher risk for
Ava has malnutrition right now.
1. Obesity, 2. Malnutrition, 3. Conditions resulting from micronutrient deficiencies, 4. Osteoporosis, 5. Certain types of cancers, for example, esophageal cancer from purging. Aside from the physical health issues, a person with an eating disorder often has a co-occurring mental health disorder. For example, a person with an eating disorder may have PTSD, depression, anxiety, or other dissociative pathology. To remove themselves even further from the trauma, it is not uncommon for a person with an eating disorder to also have a substance use disorder or alcohol use disorder. Unfortunately, the symptoms of an eating disorder closely mirror those of other disorders. It is essential for mental health professionals to uncover all possible co-occurring mental health and substance abuse issues in order to facilitate a long-term recovery. Remember that an eating disorder is just one possible method for coping with the trauma.
Yeah, her and the baby eat because she's got obesity problems herself, because she has a problem with food herself, and now she's putting it onto her children. I think one person already explained a little bit about that, but the main fact is I'm looking a little deeper as well into it, because I feel that after she shared at them about the pantry, I feel that was not called for personally. I feel that was a bit much. I know that she's talking about the stamps and all that, but she can find a solution to that herself. But apart from the eating with the children, it's not good. Right, homemade pancakes. I've made homemade pancakes. You can easily Google a recipe on Google. She's constantly on the internet. I'm on the internet most of the time anyway, right? If I want to know how to do certain stuff, right, or how to make certain stuff, I go and I Google it. My younger one is vegan. She don't eat meat, so I have to go outside of my I mean, even though I know how to cook vegan, but then sometimes you forget, and then you can get an idea of how to cook certain foods through Googling. You also, because if the child looks a certain way, you need to take them to the doctor to go check on their nutritional side of stuff. Not only that, right, the BMI changes, because remember, right, their teeth and all that stuff come into play. Calcium, which calcium can be from certain vegetables and certain stuff. It all depends on how you put it together. You can make eggplant eggplant, um, right, sprinkle it with something, put it in the oven, right? Some children also who has problem with textures. That's autistic children have a problem with textures and a problem with certain stuff. I know that, right, they don't like certain stuff, and I'm not saying that how I know this firsthand, but some children don't like textures. They don't like how certain things feel. They don't like too much spice. They don't like how it looks, like, you know what I mean. So there's a lot. No food in her pantry anyway because her and the baby ate everything. Yeah, she feeds him everything.
Emotional, physical, or sexual abuse. A person may have several different unhealthy coping mechanisms that keep them from confronting the trauma of their childhood experience. Only by addressing the trauma in a healthy way can an individual affected by an eating disorder or co-occurring conditions expect to make a meaningful recovery. How can we treat eating disorders? Treatment of eating disorders is multifaceted. Because of the complex factors involved and the history of childhood trauma, a person cannot simply stop binge eating or other disordered eating behavior. Recovering from an eating disorder requires professional intervention, usually with a multidisciplinary team.
Which means that right, taking them to the doctors and all that stuff, right? Right. When my younger one wasn't eating properly, right, I had to take her to make sure that how right she was getting the necessary, because like sometimes like you can think that you're feeding them properly and in fact you're not. You have to take them to the doctors, get them check out, get their BMI check out, their weights, whatever. Now children tastes change from day to day. It's never the same, right? It's never the same. Children might like something today and tomorrow they might not like it, like that same thing tomorrow, right? It's the same thing with their snacks. They might like this snack today and tomorrow they might not like the same snack. So once connecting with mental health specialists, the treatment for eating disorder and any coordinate occurring mental health issues can begin, and an integrate trauma informed approach is essential in facilitating a long-term recovery.
Any number of professionals may be involved in the treatment process for eating disorders. Doctors and therapists can help manage the physical and psychological aspects of the disorder, while registered dietitians can provide advice about following a healthy lifestyle filled with enriching, good for you.
And that's why she don't take them to the doctors, because if the doctors see that how they're unhealthy, they will call onto the other team, which will therefore come and check or recheck what's going on in the house. Check, like, you know, like there are the ones, like over here they don't do that, but I think Dr. Amira said that how it's a case of even when they go and they check the pantry, they check the fridge, they do certain stuff. Now, if she goes to a medical position with the children, right, the children will be flagged up. She don't want the children flagged up. Basically, that's why she don't want them flagged up. And basically, it's impacting on the children in the physical, in the mindset, as well as the how they eat. So they're not going to have a very good connection with food, right? Like I said, I have a very fast metabolism, so I'm very slim for my I'm a slim for my 40s. I'm not a very big lady, so which means that how I have to add more stuff to slow down my metabolism, and which means that how either Ava have a fast metabolism, there's malnutrition, or which means her bones will be weak. So if her bones is weak, eyesight has problems, different things is going on, hair not growing, um, child's hair should her hair should be quite big. The afro should be quite big because of her age, because she's 7, right? Children's hair grow at a rate on which depends on what they eat, right? My like I can use my 7-year-old as a good example, right? um she likes drinking water. She drinks a lot of water, uh and she eats some things, but she's so fussy. She's terribly fussy. I don't think Ava's fussy.
Foods. To help assure recovery continues for the long term, ongoing support in the form of group therapy is essential. Specifically, the following interventions may be effective in treating eating disorders. 1. Cognitive behavioral therapy, CBT. This evidence-based approach helps people challenge and overcome their distorted cognitive perceptions, thereby improving emotional regulation and helping people develop healthy coping mechanism for their problems. 2. Residential/inpatient treatment. In many cases, inpatient treatment is necessary to help people initially break the cycle of shame and disordered eating. 3. Dialectical behavior therapy. With a wide body of evidence for treating anorexia, bulimia, and BED, DBT also works to change maladaptive behaviors. Interventions focus on building mindfulness, reacting healthfully to distress, and regulating emotions. 4. Support groups and outpatient settings. Ongoing support and safe spaces to talk about trauma and other triggers for disordered eating provides people with the tools they need to sustain recovery. The dangers of untreated eating disorders. Eating disorders can be deadly without appropriate intervention. Anorexia, in particular, can kill a person affected due to cardiac arrhythmias, liver failure, kidney failure, and other consequences of malnutrition. A person with bulimia is at higher risk of developing certain types of cancer due to the amount of acid in the esophagus from purging. Obesity, a natural consequence of binge eating disorder, puts people at higher risk of heart attack, stroke, high blood pressure, and cancer. Long-term recovery from eating disorders. Treatment is available for eating disorders, and it can be incredibly effective. Understand, however, that eating disorders don't go away. Due to their past history, a person recovering from an eating disorder is always susceptible to relapse. That is why it is so important for a person to understand the complex factors and triggers that contribute to their disorder. Childhood trauma is a common thread in many people who experience eating disorders. On the other hand, it is usually only one facet of the condition. Other complex casualties, such as PTSD and other co-occurring mental health conditions, can also play a role in the development of disordered eating patterns. Eating disorders can lead to negative physical and mental health effects. Left untreated, individuals experiencing eating disorders are at higher risk for a variety of illnesses and even death. Fortunately, effective treatments are available and consist of integrated psychotherapy, healthy diets, and medication. Mental health professionals, physicians, and peers can all play an integral role in supporting a person's treatment and recovery.
Right. So because she's also given them childhood trauma, which complex in trauma, complex in needs. So we're looking at the
Clinical. Childhood trauma is common and can have profound consequences throughout a person's
I think I
life.
should play this
Adult
one.
survivors of childhood abuse pose a number of challenges for general practitioners, GPS. The diagnosis of their medical and psychiatric illnesses is complex. The therapeutic relationship can be both delicate and critical to recovery, and the treatments are varied, often expensive, and frequently inaccessible.
Hold on. I think it's this one.
How childhood trauma may impact adults. Childhood trauma can lead to physical and mental struggles later in life. Some people assume we forget or outgrow trauma. But the truth is, if someone experiences trauma as a child, it can lead to physical and mental struggles that affect their entire life. Thomas O'Connor, director of the Wynn Center for Family Research, what is the difference between trauma and PTSD? With trauma, a person fears for their own safety or the safety of a loved one. It can be anything from a loss of a parent, to experiencing or witnessing an assault, to being in a car accident. Trauma can lead to PTSD, post-traumatic stress disorder, a condition that requires professional treatment. The key sign of PTSD is that the person has difficulty doing the day-to-day things that they had done prior to a traumatic event. Symptoms of PTSD can include 1. Flashbacks. 2. Distressing intrusive thoughts. 3. Avoiding things that remind you of the trauma. 4. Feeling jumpy.
Remember, the child was jumpy when she shouted at her, so she had a flashback. That's what I think. She had a flashback, and she had some kind of emotional thingy. But you know, children, they because you notice they ran away from the door, right? They ran away from the door. And then they were crying very loudly because I think that's their coping mechanism when she shouts at them.
5. Difficulty concentrating. 6. Shutting down emotionally. 7. Lack.
Because remember, in shabby life, like the looking them away, and all that stuff. So I feel the children go through patterns, or sometimes they have little flashbacks of little things of what their mum did to them, and therefore, right, even though like they're there because they would eventually learn how to cope around her, because what children tend to do is that how is something, if you like if you shout at a child too much, right, they will try to find a way to not make you shout. They will try and find a way to make things better so that you don't shout at them. But in her case, because it is a more of an abusive situation, right, they're gonna find a way to cope with all that shouting in the house. I could not imagine what goes on even when the cameras are switched off, when we are not, or when the reactors or commentators are not able to see what's going on with them. I would imagine it's very, very horrible. Not only that, right? The environment is very important. They said that how the environment of a child is what makes a person, right? Because like you can either end up with an OCD child when they start remembering, oh yeah, right, I gotta keep certain things clean. The child gets OCD, consistently cleaning. There's another way to which, right, they have to touch everything 5 times or different things. So, like I said, when I studied, well, when I did a training, the abuse side of certain things was brought up, where like you can see the signs onto which the child was incurring, or the patient or the resident was having occurring stuff happening, where like if the person walks into the room, they'll be jumpy. If they hear the person's voice, they'll be jumpy, scared. Well, therefore, right, you have to learn to handle it so that you can try and get out what is wrong with that person, so that you can take the necessary steps. This is what's taught throughout the care system. I don't know whether it's done in certain child environments, but I will think so. Where like when they walk in, they can see how the child behaves around the parent. So if she's not taking them to school, not walking into the school, the teachers cannot see the telltale signs of how she is dealing with the children, because don't forget that how, right, when you see, don't you see smiley faces, it doesn't necessarily mean that how everything's okay in the house. You can tell when a family is happy. You can tell when the children's happy, or the child will start hitting out, because that is their coping mechanism, which I feel Aiden was doing, was hitting out, because that's what he's taught at home. He's not taught no other way. So he takes out his trauma out in other ways, right? Very same, right? He's taught to swear, cuss, hit. That's all he knows. He doesn't know any better. He doesn't get disciplined the right way, right? Because sometimes, right, boys need that baritone voice, and girls need, like, sometimes they need that baritone voice as well as the mother's voice, or they need somebody else to step in to give them the discipline. But like I said, what she's doing is not discipline, and that's abuse.
of interest in things you enjoyed before. Not everyone will experience a traumatic event the same, even those exposed to the same traumatic event may respond differently, and a traumatic event does not necessarily lead to PTSD. It's normal to react deeply to a stressful event, says Hold Oral. If you're having a hard time, that doesn't mean something is wrong with you. It's important to normalize big feelings and big reactions. Several factors can determine if experiencing a trauma will become a bigger problem and require help. How can childhood trauma impact adulthood? The impact of childhood trauma on life as an adult can depend on the environment in which
She's very barbaric because it's normal to her. It's normal because not only she do it, Liv does it as well. I think I don't remember who else does it. Nika is also come from an environment of where like food plays a part because the way she eats around her children, the way she deals with food. Food have an impact in houses, right? When most houses, right, they have an association with food. Sometimes it's a family gathering, right, where like auntie blah blah does mac and cheese or whatever, right? So like, or when you go to certain places, like the church spaces per se, right, where food always plays a part in everybody's life. It doesn't matter however you put it. Like, um, some people control their diets because like they go under discipline. She's not a discipline because even when she's doing her dietary thing, she has no discipline, right? When you start eating certain ways, like whether it be raw food, whether it be alkaline, whether it be just eating to be healthy, you have ways in which how you control your intake and certain stuff. Now, some people can eat and eat and eat and never get big. Some people can eat a little bit of something and they get big. Some people can eat a little bit of this, or they can just look at the food and they get big. So they have to learn to control what they put in their mouth every single day and certain stuff. Like me, I like before I had a time when I was eating raw plantains or blending raw plantains, making smoothies with it because it's good for the PhD and for certain things for the pH levels, and it does help. Right. Sometimes like you can make raw and cook food together, and like that's how you normally do it. Some people supposed to have 10%, I think it's 10% of I think it's 5 or 10% of raw food on the plate in comparison to the cooked food on the plate, right? Sometimes you have to have a bit of salads, whether it be a coleslaw, something raw. You can add fruit to the salad. You can do it all different ways, right? So like even when you're frying, you know that, all right, I don't use a lot of oil. Like fried chicken is one of the things that a lot of people cook, right? But there's different ways in frying the chicken. You can use either spray oil, you can use a small amount, you can oven bake it. Now in Uganda and certain countries, there are a lot of people who have a healthy way of life because what they do, they bake their food. They bake their food. Now, I've never seen this lady bake nothing. Even when you eat rice, you can add veg to the rice. If a child don't like certain stuff, then you can add like veg or whatever. My one don't really like broccoli, but that's normal. Sometimes for certain, like they don't like broccoli, and they don't like there's something else they don't like, but but then if you mix it with certain stuff, then they will eat it. Now I have my daughter, she's like a brilliant cook. She knows how to cater to my younger one because sometimes my cooking doesn't suffice her. Now she would cook all these things, and my younger one would eat it. Now, when I try to do the same thing, it doesn't be the same. When I try to implement the same thing, it doesn't do it. But my big one will make her something, and she will eat. So, and she's a fussy eater. She's really fussy, right? She's really really fussy. Now, them children over there, they're not fussy. They are not fussy. From the time you can take them to Chinese, from the time you can take them, like I can't take my one to Chinese. She ain't gonna eat nothing. I'll end up eating in front of her. That make no sense. Um, they would eat lobster. I think it was lobster, some kind of steak. I think they made. They would eat that. Right? They would eat meat. They like food, but they are not given the chance to eat like fresh pancakes, for instance. Yes, you can have ready-made pancakes, right? But microwave is not always the best sometimes because it will keep cooking in your belly. If you keep cooking things in the microwave, i.e., ready-made foods, sometimes ready-made foods have things like beetles, beetle. What's it? I think it's the coloring or something from the beetle. When Jamie Oliver did something over here pertaining to food, and he found out exactly what goes into the ready-made foods. Ready-made foods also have a lot of salt, a lot of artificial stuff in it. Right, you're not feeding your body properly. You can also make gazpacho soup, which is a cold French soup. You can blend it. If you're right, you can be on a juice diet, but then even with a juice diet, you still have to put in a kind of solid into your body, right? Because even some vegans, because they have lack of little things, sometimes like over here, a few of them has passed away due to whatever's going on, right? So, and because there's no sun over here, right? So really, when you eat, you're supposed to sweat out your food anyway. Well, that's what you're supposed to do. That's why in the West Indies, if they eat jerk chicken, yam, callaloo, rice and peas, ackee and saltfish, bear in mind that these have all peppers and stuff. The children is brought up eating this stuff, so they're very healthy. In Africa, they're brought up eating fufu, they're brought up eating amala. In certain countries, I forgot the other one, what they eat. Cameroon, they brought up eating cassava. They eat more healthy than most of the Western countries. So these children, if they was around, right, because like don't forget that Hara, she has African roots. She can also make them jollof rice. She can make them stews, right? Right. It's like right. It's like you buy, you buy beef, right, and you can make them a stew, right? You can make them stew peas. You don't necessarily have to get out of a tin. Sometimes tin is quicker, but sometimes it's not always the best. Sometimes it's best that you boil the thing down. You can make them dal and rice. You can make them aloo curry, which is like baked potato curry with pumpkin, with a bit of green peas, with a bit of something else. So like they are not getting given these things. Now in the South, I know that they cook very well. In Texas, they cook very well, especially the black people could have that link to certain backgrounds. So really she should be feeding them really good because it's not just mac and cheese they make a whole range of food in the South, right? I think it's the South. I think Texas is in the South, right? They make them a whole range of food. So what she's doing, she's making them have an association which is going to impact later on in adulthood, which is going to hurt them later on. So they're going to have great, real bad problems with food. Did you say put plantains in the blender? Yeah, you put in the blender. It's good for the pH level. You put in a blender with some oat milk, right? Oat milk, rice milk. Put in a bit of honey or whatever, and then you're good to go. You can eat raw plantain. Yeah, she never bakes any dishes or meals. Not exactly. Sometimes, right, even if you are the worst cook, yes, you can go and get the instant packet of cakes. But like I said, Google is there. If you haven't got Google, there's cookbooks. You can ask people to go about certain foods, and then she can like because the children's older, right? They would eat anything. They're not fussy. Exactly. Processed garbage. Yeah. Sometimes you don't have to eat processed. Even if you're making a sandwich yourself. One day, right, I felt for something. I can't remember what it was. A pita bread. And there's these fancy pittas and there's the pita. And the pita bread was very fluffy and nice. Now me, I snack a lot. I snack a lot. I do. I ain't gonna lie. I snack a lot. I I do drink a lot of teas, however, not necessarily English teas, but I drink a lot. I've got into the habit of drinking black coffee without sugar, black coffee with cinnamon, right? So sometimes I'll have that, and other times I'll take a whole break and I don't drink it at all. Like because I have like got problems, but it's getting better now. I found ways to deal with the gut problems. Yeah, oats milk. Yeah, plantains. You can fry it. You have callaloo, you can have saltfish, you can have whitening, even though it's not the best fish. The tilapia has too many bones in it, right? Because I was brought up with a grandma who cooked a lot, who cooked a lot of stuff. For ages, I was practicing to cook one of her stuff that she used to cook a lot. It took me a little while to learn to do it. Then gradually, I learned how to make it. Then then when I eat, if I eat certain things, if I go somewhere or I go to a takeaway, and some people cooks like how my gran used to cook, because the oldies cook a certain way back in the day, and these are all nourishing to the children, even if they don't like leaves or they don't like what the one, that one with the K, what's it called again? There's one with the Kayleys. I know eggs are expensive. Sometimes you don't need eggs. You can make an omelette without eggs. You can make what's it? What's it? Cornmeal cornmeal omelette. That's an alternative to making eggs. Right, you don't need the eggs. You can make lots of things without eggs. You can make lots of things without milk. You can just use cream, or you can use other alternatives. It's all down to your taste and what you like. Right, some people can't eat peanuts, some people can eat cashew nuts. You can even blend down the cashew nut, put it in something, make it something. It's easy. Right, this is one of the things that Queen of Fuwa taught some of her emerald greens about food and certain stuff, a certain association with food. Right, so she is not giving them a good impact like my one. Like I said, my one likes plain tortilla. Give her half the chance. She did plain tortilla. My son the other day found out that how she didn't like certain things. He bought her something, she didn't like it. She don't like spicy. She don't like this. She don't like that. She's fussy. But like I said, Ava, Aiden, Amaya, and Caitlin are not fussy children. She can literally give them anything. She's like how my other children used to eat. Wouldn't milk be bad for the pH level? No, no, no. Use oat milk or almond milk, because they're not milk. They're made from the almonds. They're made from the oat. You can even make oats milk yourself if you have, right, right. You can make it yourself. You can. It's not that hard to make. Honestly, it's not that hard to make. Right, right. And you can do green juices. You can do a salad in a smoothie. That way, right, you're getting the zinc and the everything else in between. I used to drink a lot of those stuff. Yeah, make sure you got magnesiums tucked in there. So it's a lot, but that's what I'm saying. Hold on, let me get back to the oh, it went off. Hold on. My nose is bugging me. My cold is kind of gone.
Person was raised, how they coped with the trauma and supports that were available, and when in life the trauma occurred. To determine risks of developing mental illness, addiction, and other conditions, it is now common to ask about past traumatic events using measures like the ACE, Adverse Childhood Experience. The higher a person's ACE score, the more likely it is that they will have negative physical or mental health outcomes. The studies suggest that this happens because early trauma affects stress response, Hold Oral says. Your flight or fight response, your neurodevelopment, gets off track. It suggests that if you can intervene early, when someone has a childhood traumatic event, it could have a huge lasting impact on their life. The earlier the intervention, the greater chance that treatment can help, especially for trauma early in childhood. When a person develops behaviors to deal with an early childhood trauma, changing those habits later in life can be more difficult. Can trauma impact physical health? Yes. In addition to affecting mental health and coping mechanisms, trauma has been proven to affect physical health as well. Research has shown that the experience of trauma not only influences our thinking and behavioral patterns, but also our biology, says O'Connor. Trauma influences our stress response system and may be associated with compromised immunity and poor cardiovascular health. The University of Rochester Medical Center is involved in several national studies of early childhood trauma, including the NIH Environmental Influences on Child Health Outcomes, ECHO, and the Adolescent Brain and Cognitive Development, ABCD, studies. Researchers at the Del Monte Institute for Neuroscience at the University of Rochester Medical Center.
All right. So their traumas are about to get worse. The older they get, their traumas are going to get worse. So they're saying that how, like, the children might repress it. They might shell it out. Like Aiden started hitting out in school. So if they got in the right people, right, they would have been able to find out exactly what is going on with him, apart from his autism, because there's other things going on with him in the home. So I think to myself sometimes it's a good thing I didn't become a kind of a social worker or something, because I think I would bring my work home with me. So signs of repressed childhood trauma in adults can include physical, mental, and behavioral symptoms, chronic fatigue, headaches, stomach aches, eating disorders, back pain, and other chronic illness, anxiety or fear, low self-esteem, difficulty managing anger, paranoia, depression, disassociative episodes, difficulties trusting people, which I think that how these children, right, I'm kind of glad that they trust at least Hannah. I know people, contrary to what people say, I know they said, oh, but Hannah, they need to trust somebody. If they can't trust anybody at all, right, there's going to be a huge problem, especially with the boys. Well, the boys and the girls. I don't think it's going to impact the boys more than the girls. It's going to impact both sides. Avoidance behavior, self-destructive behaviors, compulsive behaviors, isolating from others, impulse behavior, relationship problems, which comes up in most of the list. So strong, unexplained reactions to specific people, lack of ease in certain places, extreme emotional shifts, attachment issues, anxiety, childish reactions, consistent exhaustion, unable to cope in normal stressful situations. And I feel that like I said, not only does she have the undiagnosed autism or whatever else is going on with her, the children, especially Dari, who has he hasn't been diagnosed. So later on, he's going to give her a lot of problems as well. And he has an issue with food already, because what he's doing now, he's expecting McDonald's. McDonald's is not exactly healthy neither, even though there is healthy options in McDonald's, but she's not giving him a healthy option. I think I've covered it all. Yeah, I think I have. Yeah. I think I have. So the children need someone that they can talk to. And not only that, right, we're seeing signs of teenager behavior already. But that might be for a whole nother something else. Okay. So basically this is what I want to say after watching that little snapshot what Taylor put up, because I feel that there was no need for that. There was no need. Right? You get a lot of money. You even get more money than me. And I don't even own that one. What she got, right? She gets more money than even the workers who work. So she can therefore go and she can therefore go and buy bulk food. Costco, you can buy a bulk of food, right? Me and my friend tried to buy from Costco at one point because there's a Costco here, right? You can literally get together with someone and buy a bulk of food, which I feel she was doing with her mother, right? She doesn't know how to shop. I sometimes don't know how to shop, but I'm getting better at it. As I get older, I get better. But my children still used to eat food, fresh food. It doesn't matter that I'm West Indian, because in the South, certain parts of America, the food can be nourishable. There can be nourishment in the food, right? Whether you are Latina, whether you are from a normal American, I'm not going to say African American because I know some people don't like it when you say African American. Well, right, right, the food can be good. Because even when they bring the food here from the South, the food is nice. The food's nice, whether it's collard greens, cornbread, I can't remember. There's a rice substance, whether you're from Louisiana, wherever. Every single country, every single place have a healthy diet as some of the foods. It all depends on how you buy the foods, or depends on what you like to buy. It depends on how you put it together. Coconut milk can be put in most things. You can even make pancakes with coconut milk. You can make pancakes with yogurt. You can make pancakes with various things. It's not even hard, right? That's what I'm saying. So even though the eggs is expensive over there, you can find another way. You can use yogurt as the alternative for the eggs. You can use cornmeal and make an alternative to the omelette. You don't have to make omelette. Yes, it's hard to make the omelette at first, but when you make it, right, it will still be just as good. It's just like a fritter. Basically, it's a fritter. You can take, let me see what fruit you can, vegetable. Most vegetables can be turned into fritters, right? Not necessarily, like they always talk about the fried green tomatoes. You have to be careful of the oil. You put a little bit of the oil, you don't go crazy, and you can make the greatest dish ever, the greatest dish ever. You can get the most cheapest thing that is available, and you can turn nothing into something. Our parents always did it. West Indian parents, when they first came over to England, didn't have yam. They didn't have certain things. And what they did, they take that same thing and they turned it into something, right? They brought their influences in different ways before yam and anything else came over here through the Windrush era, right? So, like, yes, you can make pancakes with bananas, right? So, like, there's a lot. That one time I made Portuguese stew. I see how they make it in a different way compared to how the West Indians make it, right? They like can make black bean and rice. You can make a variety of stuff. I'm telling you, it's not hard. If you are that thirsty, you're so thirsty, right? People tend to make sugar water. In Trinidad, that's a thing, or West Indies, they drink sugar water, right? When they have nothing. They don't really, Kool-Aid is a thing that is over in the West Indies, but they have alternatives, right? Right. So, right, you can blend a lemon, you can strain the lemon, or the next thing you can do, you can blend the lemon, put the sugar in it, and you can leave the bits in it if you like the bits. Some people like the bits. You can take a whole orange, you can peel the orange and make that into a drink. It's not hard, right? That way, right, you're still getting your vitamin C and all that stuff, right? Sometimes I'm bad for it, and sometimes I'm on top of it. It all depends on my moods. I'm one of them. I'm a typical Sagittarian anyway. It all depends on my moods and how I feel. My friend don't eat meat at all. I have one friend, she don't eat meat at all. She come from Suriname. She don't eat meat at all. She's a vegetarian. Um, there's somebody else I know, they're vegetarian. They don't eat meat. Some people don't even eat out as a rule. They will cook everything in their house. They won't even eat a takeaway. They will cook everything in their house. They will make a fake away if it comes down to it. Right. So there is alternatives there. She right, you know what I mean? Even me, I'm still trying to find out what my little one likes because she's fussy. She's fussy. She will quicker eat a cucumber, a kiwi fruit, than she would eat anything else sometimes. Right? She likes her sweets, yeah, she likes her sweets just like any other child. Right. But at the end of the day, it's trying to get food into her. So like I said, her big sisters sometimes have to take the reins because I have no patience on certain stuff. So they will take the reins because otherwise, right, otherwise she'll end up eating the same thing over and over and over and over again, which means that Harat should be lacking something, which goes into jaundice and all sorts of things, something wrong with the knees, the legs, all sorts of stuff. Now she's actually getting a little bit bigger. She's actually getting tall. I'm quite a shorty, so she's a little bit tall to me, but she's not tall, but she's tall. So so basically she's hurting the children. She's hurting the children. Yes, discipline them. Yes, I'm not going to say don't discipline your children, right? Don't discipline them, right? I'm at my soft era now. I call this my soft era. I used to be strict with my children. My children can tell you right now. I used to be strict with my children. Since this one come, I'm very soft with her. So I understand why grandparents are different with the grandchildren, even though I ain't got grandchildren, why they are different with their grandchildren than they are with their own children. When the children gets older, your temperament tend to change, right? Right? You're different. There's a difference to you. And even though, like, especially with the youngest one, I'm different. With the older ones, I was strict with them. They couldn't even breathe at one point because I came from a strict parentage. So her shouting at her children is hurting them more than helping them, right? In pantry, right, there's certain foods you're supposed to put in the pantry. Somebody showed the pantry. There's not a lot in there. There's all her stuff. There's nothing for the children. It doesn't matter where the children is up at the other house most of the time. You have to have food there for the children. You have to make sure that they have something. You are still getting the money for the children. You have to make sure at least like buy them stuff other than just buying stuff for the children. Otherwise, it looks like the how you're just, which we know happens, they sell it or whatever's going on in there in that house because we can't see what's going on in the house. We can only imagine what goes on in that house. So, yeah. So the children might just make fake memories. They might come to a place when they get older, they start making fake memories because their mum gave them such bad memories. They can be problematic to other people, other children in class, right? So yeah, that's basically what I want to say about the whole behavior of that whole video. What she did, it's not on. Like I said, so right, it's best to advocate for the children. I don't know how you do it. Flo was trying to do that. I will bring up Flo every time. You know why? Because I believe Flo was trying to get them children sorted from the outside. Because sometimes the people in the inside ain't gonna do nothing. The people on the outside that will quicker do something than the people in the inside. And people need to understand that how these children are getting hurted, they're getting used, they're getting abused, whether they're there whether they're there 1 week, whether they're 2 days, whether they're 3 days, back to the other side, they're getting abused. And it's not on. And any child who's been through what they're going through when they were younger, loads of women must get triggered just watching what's going on because it's not funny sometimes. Yes, I mean, fair enough, right? Yes, she is. Jasmine is a big girl. She is a big girl in size, height, and everything. They call that size hench. She's a hench woman. But I met one who is tall like her, and she dresses like puss, and she looks like a woman. Right. So I don't know what's her problem. She needs to get fair. I don't know. But anyway, right. But anyway, right. You can suggest a whole heap of madness to her. She ain't gonna listen. She said, "Oh, it's old ladies." Blah, 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 blah." But what you're doing, you are hurting your children later on. I believe that how Aiden is not gonna go out with a black woman because of his mum, because he's gonna resent her. If you go, there's a video where I said Aiden's gonna resent her. Buffalo Bill also done the same video where he said that how he's going to resent her, right? Because that's also a form of mental health, what he's going through. As a boy, particularly a black boy in America, a black man in America, he will end up in the system, right? The system for young black men is hard. Now you lot got the worst of the worst over there now. It's going to be hell for the black men over there now, unless they stand on their 2 foot and rebel. So because he's a young black boy, he needs a good male influence around him to help him through it. Him and the dairy needs a strong kind of figure, not saying father figure, a male figure, because with boys they do need that. That's why when boys come to a certain age, the women will send their sons to the father so that the father can grow them up. That's traditionally happens in some houses. So she I don't know. I'm not going to say no more. I'm just saying because he's going to resent black women big time. He's going to resent them big time. The girls have to be careful because their mum is posting them all over the YouTube. They don't know who's watching them. So you have to be very careful. And Jarvis bots and all that, we need to carry on using Jarvis bots as an example, because that just shows how hi Blanco, that just shows how easy children can slip through the net. So at this rate, if she doesn't protect the children, right? Like they said, they brought up the food disorder was SA, right? Then you're getting traumatized at school. So traumatized at home. You're leaving from school with all the noise, because I call certain things noise. Noise meaning that how right you're out with your peers. Right? This is why certain adults sits by themselves. Oh, and talk about Jazzy. When like working people, when they're around their colleagues, right, and they have a hard day, right, and then you leave from your workplace, and then you come home and you have to deal with the same rubbish over and over again. That's not even good for a person. That's another extra traumatization. Children is the same. If they're getting bullied at school and then they're getting bullied at home, it's not going to help them. My readings on her must be helping. Oh my gosh, it is, yes. More ways than one. Right, they get so if they're getting bullied at school, they're getting bullied at home. If they're not being if she's locking away cupboards and of food and different things, right? She forgets one thing, right? Like I said, and I always use Nature Boy. Nature Boy thought he was a smart lad, putting everything up on all platforms and this and that and the other, right? Just because she's not putting it up on Facebook, because she puts some things up on Facebook too, right? If she feels that how people are not watching her, she's sadly mistaken. And it's worse now whoever is in the White House, that's going to come even more worse now. Yeah, using food as a leverage, using food to say that how if you don't clean up, you're not eating. You're not eating. Now, like, remember in the car what Ava said, but Mum, I cleaned up, but you didn't give me this. But people don't want to do nothing. You see what I mean? They don't want to do nothing. I don't know why. I don't understand it myself. I put up the video from Taylor X, and what did I do? I looked at it. I must have looked at it like 3 times. And I said, you know what? I'm going to take it down. And then I just put what I have to do in the community section because she's traumatizing the children. I don't watch her. I'll be never watch her. No, it's not worth watching her anyway. I mean, I watch her through the reactors because it's levels to the thing, man. Like, you know, she's scared that how the food stamps is gonna change and all this stuff. And so she's saying basically, does that mean that how I gotta get a job? Girl, even if you are on the thing, right, you're supposed to go and try and get work. You have to try and get work. If your children don't motivate you to go to work, there's something wrong with you. Like I said, if you can't open the door, you have to kick down the door. You have to keep trying and trying and trying and trying and trying and trying and trying, push and 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 push until you get whatever work you need to get. You're in your 30s. I'm 50, soon 59. No, I'm 59, soon 50. Myself. Yes, poor baby girl said that. So clean her whole house and didn't get anything like Cinderella. Yes. Yes. So she's using food as leverage. She's using them as labor. They are the ones waiting on the little brother, even though normally siblings normally do look after the younger ones. That's normal. You know what I mean? The older ones look after the younger ones. But like if they're cleaning after the sibling, if they're waiting on the sibling, then the sibling he's getting more than what they're getting, then it becomes a problem. I don't have to work, but I still grind. Yeah, exactly. Right. So basically they would like, because right now they don't want to have time with Legendary right now. They don't want to deal with Legendary right now because they know Legendary gets the best of everything. When he's doing something, right, they get shouted at. That's traumatizing because the child, I don't know what part of the video, the child jumps. Well, she turns and she says, "Don't go into the pantry." Right. The child, Amaya jumped. Amaya jumped. Basically, she did. She did. I don't know whether anybody else saw it. I saw it. I saw it. But I can't get it. But when I'm looking at Taylor's one, right, it's like it's quick. It's real quick. I think it's either in Taylor's thing or in one of the reactors. You see the child jump out of their skin. She shouts at them. And then they close the door and then they go. And then she goes to them, lock my bedroom door, lock my door. So you're doing what you did to them when they were younger, when they were 2, 3, 1, younger. You're locking them away again, but they're older. That don't make no sense. That don't make no sense. So that means that you're continuously traumatizing them. They will not have a happy childhood. They will not say, okay, I remember when my mom hugged me. I remember when my mom took me. Sometimes you don't even have to take your child out to have good memories. Just hugging them. I wasn't a huggy mum, huggy mother, because I wasn't brought up with a hugging mother. But when I take her, we hug. We hug because you're making them feel secure. You have to make the child feel secure. And even if she can't talk to me, she have her sisters she can talk to. So if she feels, oh no, I can't tell mum, she goes to her sister, she goes to her brother. They have nobody to talk to, really. And I don't even know whether Hannah talks to them to find out what goes on in that house when they leave. Right? Plus, they don't bathe. That's one of the things of mental health. When a person don't bathe, when they have bad mental health, the hygiene is low. The hygiene's low. People don't look at it like that. They think, oh, they turn up their nose at the person. Where. Some people have bad mental health. That's one of the indications that they have mental health. Right. Not only that, right, especially with certain things going on as well. Right. She gives bird baths. I don't understand the bird baths. Like, you can at least take a bucket, boil water, you get the bucket. In West Indies, they don't have showers, well, but they probably have showers now. They will get a whole bucket of water and they will turn that into a shower. West Indians over here are very resilient. If they reach somewhere and the situation's not like that, they make that shit work. They will make it work. They will somehow say, okay, I got to boil water, I got to do this, I got to do that, so that they can continue look after their body. She doesn't do nothing like that. That's why sometimes she does look like she does smell on the screen. She does. Right? That's no dig. She does look like she smells on the screen. Because when you're light skin, because I have a light skin one, when you're light skin, the color looks like you got dirt on the top layer of your skin. If you don't clean that top layer of your skin properly or thoroughly, right, it makes that skin look dirty. So I remember how anything you eat, it comes out in your pores. You have to be mindful. If you eat too much fish, it comes out in your pores. Sometimes you have to drink lots of water. You have to eat lots of this, lots of water type of vegetables to keep everything going. Right? You yourself have to check yourself as a woman. Check the armpit. You have to, sometimes you're like, you know, you have to check yourself as a woman. So Medusa Gotti wasn't wrong in what she was saying. That's why I said she had points in there in what she said. Right? It doesn't matter the reason is why she's doing what she's doing. She had points. She made points. Right? If you have a problem and there's something wrong with you, right, you have to go find out what is the problem. When I had a chest infection, like me, I'm very stubborn. I don't like go doctors at all. And my chest was so bad. When my chest gets so bad, I had to go to the doctors. When the doctors checked what was wrong with me, he said, because I thought it was just asthma. Because asthma people, they can get chest infections quite easily, right? And it could come and it looks like an asthma attack. When you go to the doctor now, you check it, they say, oh, it's chest infection. You cannot not, I'm not saying the doctors are the best. No, I'm not. But sometimes, right, you have to go check things out, make sure everything's fine, make sure if you have problems with your skin, you say, oh, I've got a problem with my skin. The doctor will there tell you, okay, right, you need A, B, C. Mind you, right, black soap will do the trick. Black soap takes off one layer of skin. There's other soaps like, I forgot what's it called. There's another soap that takes off the layer of skin. You have to take off the layer of skin. Eczema people, particularly, they have to be careful. So, yeah. So basically, everything what Blanco said is literally coming true, and maybe we are going to see other things happening at this point because the children is mentally not well. Mentally not well, I feel, and she is making sure the children has some kind of trauma because she has traumas. Let me see if it's gonna come up. But I'm not gonna stay on here too long, okay? I'm not gonna show you the video because I don't think it shows it, but Taylor's got it. Hold on. Taylor's got it. There's only so much time this team will continue. Oh, my daughter's laughing. There's only so much time that this team will continue. Everything has a finishing time and an end time to everything. And her time's coming very soon. She's her own downfall. And if she feels those children ain't somehow, the children might be that too, because everything's online.
Get out of my pantry! Going out wrong! They is irritating me today. They fucking crazy.
Okay. Oh, it's playing up now. My thing always plays up at the wrong time. I think it's here. She said they're irritating her. They're your children. How are you irritated by your own children? I don't know. She has a mental health problem to herself. She's mentally not all there herself. I'm not saying like people don't have mental health. Some people have underlying mental health. That's a child crying in the background. Sounded like it could be a Maya or Ava crying. Well, you don't see them, you just hear them crying.
Get out of my pantry! Going out wrong!
Very mean.
They is irritating
Very,
me
very
today.
mean. She's
They
traumatizing
fucking
them.
cry too much. This shit irritates me. Go to your room, close my door.
She don't want them there.
I gave everybody their own snack. I gave everybody their own. Everybody had their stuff, and they just keep trying to go in there and get stuff.
They're
First of all,
children.
I just cleaned it. Second, get the fuck out of there.
They're children.
And they got like 4 waters sitting on the counter, and I said, stop getting water. It's okay, I'm gonna just.
In West Indian families, right? If you haven't eaten food or you're supposed to do what you do, right, they'll give you water and they say, let the water fill up your belly. What she's doing, she's filling them up full of water. Filling them up with water. But then she's taking away the water. So how is that helping?
Put the shit in my room. I'm gonna get a lock on my pantry. Nobody gonna be able to go in there.
She says she's going to get a lock on the pantry.
Get out of my pantry!
She says she's going to put a lock on the pantry. Yeah, they can't even have free water. That's very evil. Very evil. Very, very evil. Very evil. It's not going to end good, this lady. I ain't putting mouth on nobody. Because sometimes life can be hard and rugged and rough and blah, blah, and whatever. But you don't take out your anger on children. It's because they're smaller than her. She's big. She's big. You know a bully. You know when, right? You know when a bully is bigger than you and you're small, right? I'm bigger than you and you're small. That's what she's doing. She's bullying the children. That's what she's doing. It's a form of bullying. It's a form of bullying. So basically, I don't know. Like I said, that's one of the reasons why she don't take them to the doctors and certain stuff. Because if the doctors looks at them and see they're not given the right nutritions and stuff like that, you know, doctors, right, they have links to certain organizations. So, like, you know, it's crazy to me. I've never seen nobody like this woman before in my life. I've been brought up by a strict woman, a woman who shouts. I've been brought up with women like that, and they're nothing like this. And I'm just surprised that she got through the cracks so long. And I'm hoping that, I'm not saying that something happens, but I feel with these children, something needs to happen at this point. It's the kids' food stamps, though. Exactly. They need nutritional meals, and they are starving, and a snack won't do. Yeah, snacks won't do. Like my one loves potatoes. She likes starchy food. But she likes cucumbers and she likes certain stuff. And you're shouting at them like that, like as though they shouldn't eat nothing because you are busy making a bed, which is probably with their money that you got that bed. They're supposed to have clothes. A child's supposed to have warmth. Warmth, a roof over their head, food, clothes. Was it shelter? Shelter, food, clothes, water, etc. Those are the 5 things that a child needs. Nurturing. They need nurturing, mental health things as well, because guarantee when them children are old enough to talk and tell and say their mind, it's going to be peak for her. It's going to be peak, as my children will say. It's going to be peak. And that food stamp debacle, what she's talking about, if I was her, I wouldn't even say nothing. I'll just keep my own thoughts to myself. I keep my thoughts to myself. If you have nothing, what I say, if you have nothing good to say, don't say nothing. Don't say anything. Keep your thoughts to your damn self. Don't know what world she comes. Don't know what world this lady comes under. She does have a mind of a 14-year-old. They all have mind. The whole of the mummy sector that the mummy sector reacts on all have a mind of a teenager. They move like teenagers. They move like single women, as my daughter will put it. They move like single women. They move like they ain't got care in the world. I know someone who have a large amounts of children, but the children's always sorted, always fixed up, always nice. Oh yeah, JJ. That's another one I need to play. JJ. And what he said. Let's see if I can find him now, but I can't find him. JJ made a good point.
Stunt them. Why y'all don't brag about your kids? Like, I swear to God, I know women, y'all. No bullshit. I know women who like stunt their kids, like they fucking kids is they fucking life. Like, all they post is their kids, new outfits, new hairstyles, their achievements from school. That's all they post is shit about their kids. They adore their kids. And then when you see a picture of them with their kids, the kids is all looking amazing. And the mom might be back there looking tired. Hair not all the way done, just a regular ponytail on her head. But a bitch like you and Liv and Nika, oh no. We see a picture with y'all and y'all kids. The kids is looking raggedy than a motherfucker, and you in the middle just cheesing, thinking you're cute. I'm here to let you know. Take it how you want to, bitch. No real man is fucking with that.
And for ages, JJ was showing her the mirror of herself, and she didn't like it. JJ said that he was brought up with a single mother. One time, JJ spoke, and he said, I think he said he's brought up with a single mother, and he said, you know what? The mother made sure that we had shoes on our feet, that we dressed okay, that we were fed. This is from a man's point of view. So you are like, it still comes down to the same thing. You're traumatizing your children for what? You want them to come out just like you. Your children is supposed to be 10 times, even 100 times, trillion times, million times better than you. Don't matter the form in which it comes in. They're supposed to be doing better than you. Like I said, I always used to say, in the 90s, there was this thing. If you are seen walking around looking like puss and your children look like rubbish, people will talk about you. That's how it is. That's how it was. In the 90s, I used to dress up my daughter like a little dolly. Is that deep? I used to dress my children. They used to wear the same color. We all used to wear the same color, all similar. When we go out, we all look the same. Nobody was left out. Nobody was different. Nobody was separated. All right. That's how you are. That's how you know it's a loving mother, right? And like the mother might have not a lot, but her children will look nice. It's deep. Traumatizing the children for what? Why are you traumatizing them? Locking the cupboards of food. Children will sneak. That's childhood. Children sneak and take food. Right? The most you can say is, look, right, don't take it. Do you not want it for this day? Do you not think, like, you come and you say it nicely, right? I'm not saying baby them or nothing, right? You say certain things in another way so the child can understand. These children are different children. Whatever they call millennial children are different. You have to come at them differently. You can't deal with them the same way as when you was growing up. You have to deal with them in a different way. You can't hold back food. Some children, I've seen children smaller than Ava cooking food, standing washing dishes, all sorts of things by themselves. Why? Because they see it in the house. If a child sees you hoovering, the child will pick up the hoover. They start hoovering. If they see you sweeping and cleaning up, they pick up the same habit. Right? If they see you cooking, they come over and they cook. They help you cook. Now, the way how you burn those grilled cheese sandwiches, that's a whole nother different conversation altogether, right? That you could have just put them in a toaster, you could put it in the oven, however. Everyone's different, right? Like I said, if you're from Texas, from what I know of Texas people, Texas people can cook. Louisiana people can cook. So certain parts of America where there is people of color, they can cook. Latinos, I know for sure, can cook, right? I can tell you that Venezuelans can cook. Africans can cook. So I don't know what planet this girl falls under. She's using, and I know that there are these people who traumatize children in other countries. So I'm not even saying that she is unusual, because there's many others. It's just sometimes, right, they don't display it on the YouTube. When you're displaying it on the YouTube, you're going on like a minstrel. I still will use the word minstrel because that's what you are. Black women are seen as fetishes, and you feed into the fetish idea. Oh, I got to be sexy. Oh, I got to be like this. You more or less said on the live when your children were sitting there that how right you had sex with a man, and that how right you had an AB in front of them. That alone, that's what I said. When they go to school and they start repeating what you're saying, do you not think that how right the teachers are not watching you at this point? Teachers watch everything that you do, you know. They watch how the child is. If the child don't be in school of this certain amount of days, they're watching all that. So when you're thinking that how right they ain't watching how you're behaving, they're watching you. This girl will never learn until there's consequences and somebody advocates for the children. And I'm being quite deep with it. These children are going to grow up traumatized. They're going to grow up traumatized. They're going to be another set of children that's going to be out there in the system doing crazy stuff. Why can't someone come who have certain credentials and show them something different? They need to be shown something different, something that other than what their mum shows them. The child said she wanted to own a business, never gave her a side look. I don't know. What's all that about? If my child said that how they want to be an owner of this and that and that and that, right, you smile. Because that means that how they obviously seen something that they can connect with, or they've seen someone who looked like them, who they can grow to be better people. I don't know. I don't know what else to say. I'm not trying to give a speech, but I'm just saying that how this is what I see. So, and if I have to fling in the recent thing, I don't know. So it's been a year with that little girl, right? Do people want to see a repeat of that on this thing here, where like we see them how much when they're teenagers and they're sitting there telling us stories and they're saying, oh yeah, this was happening to me, that was happening to me, I got essayed, I got this, I got that. That means that how right we are making people that is coming up with another set of issues, mummy issues, because I assure you these children are going to have mummy. Aiden's probably going to have mummy issues. I don't know about that about dairy so much. The girls might not have the daddy issues because their dad's there, but like they will have mummy issues. When he goes to choose a young lady, you know, like normally, right, when a boy is brought up, right, they choose something that is nearest to their mother. So I don't know. I ain't trying to have a speech, but anyways, I'm gonna come off. I'll go and do my little things because it's gone into 2 hours. I didn't even realize it was 2 hours. But anyways, thank you, Medusa. Oops. Medusa and Blanco and Passionisa for coming through. And I'll see you in the comment section. Please put in the comments what you think of what I said. You agree, not agree, whatever. I ain't gonna be mad at ya. You put in what you think, as long as it's in a respectful manner. And we can talk in the comment section. With that said, I'm gonna see you later. Take care. Bye.